In a sharply worded response, a lawyer for the nursing home contested the agency's findings, saying that its staff had been constantly monitoring residents and that there was no indication based on actual conditions that a 911 call or an evacuation was necessary before residents began to fall ill. Eight of the residents died that day, either at the home, known as the Rehabilitation Center at Hollywood Hills, or at Memorial Regional Hospital. More than 100 were taken to Memorial and other hospitals, and many have now been moved to new nursing homes. Local authorities said that a ninth former resident died on Tuesday, but the medical examiner has not yet determined whether the heat played a role in the death of that resident, Carlos Canal, 93. According to the agency's order suspending the center's license, issued on Wednesday, the facility's medical records were replete with late entries, meaning updates that were supposed to describe medical indicators such as blood pressure and temperature at a certain point in time, but were added later. The facility also entered late entries into medical records claiming safe temperatures for patients, Mr. Sr. said in the statement, while those same patients were across the street dying in the emergency room with temperatures of over 108 degrees Fahrenheit. In one instance, at 4:42 a.m. a nurse wrote that a 78-year-old resident's temperature was 101.6 degrees. But the resident had arrived at the hospital's emergency room in cardiac arrest 10 minutes earlier, with a temperature that the hospital recorded at 108.3 degrees. She could not be saved. Others who died had body temperatures of 109.9, 108.5 and 107. In another case, which the agency described as very egregious, someone at the nursing home described an 84-year-old patient as resting in bed with breathing that was even and unlabored. By the time that update was added, the person had already died. But in a statement, Kirsten K. Ullman, a lawyer for the nursing home, said the late entries into residents' medical records were not significant since workers often wait until the end of their shift to update records. Since the home was emptied before the end of the early shift on Sept.13, some entries could not be made until residents had already left, she wrote. Late entries document care given during the shift, but which was not documented due to circumstances beyond the home's control, Ms. Ullman wrote. The alarming body temperatures cited by the agency, some of which were taken at the hospital, were much higher than those documented by the nursing home staff while the residents were still there, she wrote. The caregivers at Hollywood Hills responded to the conditions with which they were faced in real time, she wrote. It is only based on hindsight of outcome that the reasonable actions taken at the time are being criticized. The agency had already temporarily stopped the facility from accepting any new patients, but on Wednesday, it moved to close it down entirely. Gov. Rick Scott has also ordered the agency to cut off the home's ability to participate in Medicaid, and the Hollywood Police Department and the Florida Department of Law Enforcement have opened a criminal investigation. On Tuesday night, the rehabilitation center filed a complaint in court against the healthcare agency with the accusation that 2 orders from last week that temporarily shut it down were improperly issued and violated its rights. In its complaint, the facility reiterated what officials at the nursing home have insisted over the past week and what public records released by the state validate: that the staff there tried to tell state officials and the power company multiple times that they needed help restoring the home's air conditioning system, which had stopped working after the hurricane knocked out a vital transformer.